Hello, hello. Welcome in, everyone.
Hi, everybody.
We'll get started here in just a minute. I'm just going to give a little bit of time for everyone to join, and then we'll get started with some introductions. All right, welcome, welcome. Knowing that we just have a short period of time, I want to get started. So welcome, everyone. Thank you so much for joining us here. My name is Kelsey. I am the manager of patient experience here at Oula, and we're very excited to welcome you. And we'll get started here shortly. And I'll throw it to Casey to introduce herself and get started.
Hi, everybody. I'm Casey. I'm the director of midwifery here at Oula. I'm a midwife myself. I'm also a parent to 3 kids, and bring kind of all that perspective to this evening. I look forward to this time with all of you. So thanks for being here. You can jump into the next slide and we'll just dive in. So the way tonight's going to work, we have some slides to kind of go through some frequently asked questions about sort of who we are and what we do at Oula. And then that'll be kind of the first part of our time together. And then we'll have time for some questions. There's always amazing questions, and we'll get through as many as we can sort of at the end of our time together. So what is Oula? So Oula is a modern maternity center that combines the best of midwifery and obstetrics to deliver a personalized and evidence-based pregnancy experience. So that is what we have set out to do. And we're going to talk tonight about how we do that. So you can go to the next slide. So what do? We provide full service pregnancy care. So what does that mean? That means in-person and virtual prenatal visits. That means attending the birth of your baby at Mount Sinai West, which is our hospital partnership. We'll talk about all these things in detail as we go through. We also provide pregnancy and postpartum education integrated into your care. And it also includes postpartum care throughout the 4th trimester. So where are we? This is important. So we have 2 clinic locations. We are located in downtown Brooklyn, the Brooklyn Heights neighborhood. And we also have a clinic location in the Soho neighborhood of downtown Manhattan, both conveniently located with lots of train lines. When you enter care at Oula, you will choose your clinic home, and that will be where you will receive all of your prenatal care. So you don't float between the 2 clinics. You'll decide which clinic is your base for prenatal care. And then both of the clinics will deliver your baby at Mount Sinai West. So you will have a clinic team that you will get to know that is specific to the clinic location that you choose. And who are we? So I love this slide. This is just a few of our awesome clinical teammates here at Oula. And it's, really important to us that our patients see themselves reflected in our care team. And we have a really diverse group of clinical experts who come from experience all across the city in a variety of birth experience and settings, such as home birth experience, birth center experience, labor and delivery, and high-risk care. And a lot of our clinicians have deep roots at Mount Sinai West specifically. And so it's sort of like a nice reunion coming back together in this new exciting project that is Oula. So some of you might be here tonight because you're looking for a midwife, and others of you might be like, what is a midwife? As someone who is a certified nurse midwife, I've answered this question of what is a midwife my entire career, and I never tire of it. And so, it's important to know that midwives are licensed healthcare professionals with an expertise in low-risk pregnancy care. And we work in a setting of collaborative care. So you'll hear that term a lot tonight, and kind of as you explore all our educational content on our website as well. And collaborative care, I'll talk a little bit more about this in depth, but it basically is this concept of midwives, OBGYNs, and other clinical care members working together as a team with our patient at the center of that collaboration. So what does that look like in terms of kind of the structure of the clinical team at Oula? So, at Oula, you'll mostly see our midwives for your prenatal care and your labor. So everybody who enters care at Oula will start with having a virtual clinical visit with one of our midwives. And when you come into the clinic, you'll meet with all the midwives on your team throughout your care. If moderate or high risk medical things arise during your pregnancy, you will work with our OBGYN colleague who we're collaborating with. And so our OBGYNs kind of are there as a support person for both our patient and also for our midwifery team, right? So midwives, as I mentioned, are experts in low risk pregnancy care. So when we're trained to identify complications that arise in care and to co-manage and collaborate and consult with our OBGYN physician. So every clinic at Oula has an OBGYN who you can meet with for a virtual consult. You could see them for a visit, potentially, if those medical concerns arise. If they don't, you continue on with your midwifery team, and your midwifery team is who greets you on labor and delivery when you come in. And so when you come to labor and delivery, how does that translate on the labor floor? We work really closely with our hospital partnership at Mount Sinai West to have a robust team of 24/7 coverage from our hospitalist team at the hospital to provide emergency services should they arise on the labor floor. So you'll always have your Oula teammate, your Oula midwife there navigating whatever experience you are going through both prenatally as well as during the labor and birth itself. So in the event that you were to need a medical or surgical intervention on the labor floor, that you would still be an Oula patient cared for by your Oula midwife in collaboration with our hospital partnership and all the expertise that comes with high-risk care as it's needed in the hospital setting. You can go to the next slide. So let's talk a little bit about Mount Sinai West, because I know when you're those of you who are joining us tonight, as you're looking around at different places where you might want to give birth, you want to educate yourself and learn a little bit about why you might choose one hospital system over another. So we were doing that research too when we went as Oula, when we decided to partner with Mount Sinai West. And why we chose this hospital system is that there is a long proven track record of health outcomes that far exceed other hospital systems in New York City. And that's one of the reasons that we were drawn to Mount Sinai West. There is a history of having an in-hospital birthing center at Mount Sinai West. It's closed now, but that sort of philosophy and understanding for the midwifery model of care, which is a model of care that focuses on normal physiologic labor and understands that this is a whole person, human, transformational life event, right? And so there's that underlying understanding and history of midwifery at Mount Sinai West that made it really a seamless transition to bring our care model to the labor floor at Mount Sinai West. And as I mentioned, many of our clinicians have worked there previously as nurses, as midwives, as OBGYNs. So a lot of connections on the labor floor. And we have a lot of people on our team who are real kind of cultural ambassadors and leaders in that space of kind of building out that type of experience on labor and delivery there for our patients. There's a lot of great options for managing pain and labor at Mount Sinai West. Specifically, we're able to offer, in addition to epidurals, hydrotherapy through showers and in-suite bathrooms in all of the labor suites on labor and delivery. And we also offer nitrous oxide there as well. Which I think is something that is unique to our hospital system when you kind of look at some of the other hospital systems across the city. And I mentioned that we have our deep history and roots there as well. You can go to the next slide, Kelsey. So this is sort of just an overview of what we call the patient journey and what a journey it is, right? And you don't need to kind of memorize this visual here. It's just meant to kind of show you that we really think about kind of what are the most important touch points throughout your experience. We think about kind of helping to kind of guide our patients in the sense of like, here's what's coming, here's an overview, right, of the whole experience, but then here's what's coming next, right? So that you don't have to memorize and stress about 9 months of prenatal care. You can kind of focus on what's happening today, what do I need to know about what's coming next, right? And then kind of when you feel ready, you can kind of engage with like what's coming down the line and know that there's like really structured resources, support, education, and a care team there to guide you through that experience. So you'll see some things on here we're going to talk about in another slide that are kind of interesting and a little bit different than some other traditional prenatal practices. You can go to the next slide. So why Oula, right? I think, why are we different? What makes what we're doing here stand out? I've worked across many different practices over the last 20 years in the New York City birth landscape. And I think one of the things that is really unique is that we are committed to bringing this model of care to more people and doing that with a lens of equity and making sure that there is more accessibility to this care model. And so we are in network with most major insurance plans, including Medicaid, which is something that is really important to us. It really aligns with our values as a team. And I think as you look across the city, if you were looking for midwifery care or curious about that, you'll find that it's really challenging to be able to access midwifery care in network in New York City. So we're really, really proud that we're able to do that. It is important to look at our website to check for like the full comprehensive list. This list is a sample, but the up-to-date information about insurance plans is on our websites specific to your the clinic that you choose for kind of your home clinic. You can go to the next slide. So a couple other things I just want to highlight about what we're doing and building at Oula that might be a little different. So one of the things that is central to our care model is communication and trust, building that trust and communication with your care team during prenatal care is the foundation of our care model so that we know that we'll be able to create a safer and more satisfying birth experience on labor and delivery by putting in that time and getting to know one another, you getting to know us getting to know you. And we have to do that through spending time together. So our visits are longer than traditional, other traditional OB practices across the city. We have more time together. In addition to that, most of your pregnancy journey happens outside of the clinical visits, right? So you have your visits, you go along your journey, but how many times have you left your clinician's office and you're like, I forgot to ask X, Y, or Z, right? And so we are really, really proud that we have a dedicated clinical team and patient experience team that helps to answer all your questions and solve problems that arise. And Kelsey's part of that team, but we also have clinicians that are dedicated on that team as well that you can reach by our portal. And it's been just a real joy to kind of see that evolve and grow. And to see how that keeps our patients feeling really connected to their care throughout the entire time, even when you're not in the office, right, physically. The other thing we do is that we integrate education right into your care. So we do that by building out our really unique patient portal. We kind of think of it as a way of keeping people off Google and pregnancy, right? We create evidence-based resources for any topic that you can search for in our portal. And again, we kind of guide you through like what's coming next, what are some key decisions you'll want to think about. Here's some resources and questions to ask yourself. We give you suggestions of questions to kind of engage with your care provider about. And then in addition to that educational kind of sort of structure that we have in the portal, we also have opportunities for group classes that are part of our care model. So it's not like an add-on thing, it's integrated. There's no extra hidden fees or anything like that. It's integrated into your care. We come together as a group to talk about building birth plans in the third trimester. We gather at the end of pregnancy, right before kind of everybody's off to give birth. And it's a wonderful time to come together, talk about getting ready for the birth. And then in addition to that, we know that the fourth trimester is often overlooked in traditional OB practices. And this is a space where we think we really can make a difference. And so we offer a weekly postpartum office hours that patients can drop into. Again, this is integrated into your care, and it's hosted by a lactation consultant and postpartum doula, where we can provide holistic care, and you can connect with other Oula parents and keep you connected to your care team throughout the entire fourth trimester. And specifically, we do offer a space for our BIPOC identifying patients that is once a month, because we know there are unique needs in that space. And so we're really proud to be able to offer that resource to our patients. Okay, so I'm telling you a lot about Oula, and now you might be thinking a little bit about kind of yourself and like, how do I know if I'm a good fit for Oula? And what does that mean, and what does that look like? So I think if you're looking for midwifery care in a hospital setting, this is definitely a great fit for you, right? We do not do births out of hospital. Sometimes people ask us, can you do birth in a birth center? Can I have my baby at home if I come to Oula? All of our births are attended at Mount Sinai West by our clinical care team. If you want to try unmedicated labor, or if you want to try nitrous or epidural, any of those would be a good fit for us. I think there is a myth out there that if I'm choosing midwifery care, that means that, an epidural is not going to be an option for me. That's completely not true. So I want to make sure that that's clear. We have a 24/7 anesthesiology team on call for our patients at Mount Sinai West. Our midwives are really skilled at integrating our care model approach, centering movement, and all of our comfort and coping strategies and tips and tricks, whether you have an epidural or not. So 100%, either end of that spectrum or anywhere in the middle where you might kind of be envisioning your experience, Oula and Mount Sinai West would be a great place to land. If you're over 35 and you Googled that on the internet and you found, somebody said that you are an elderly pregnant person, apologies on behalf of the internet. We don't prescribe to kind of one number in that way dictating your care plan. We really have a strategy where we really personalize our clinical care delivery. So we know that we all bring our health history and our health wisdom, as I like to think of it, to our pregnancy journey, right? Everything that got you to this moment of this experience. And so Kelsey's going to talk a little bit about our intake process here in just a second. But absolutely, if you're over 35, you are welcome to join us at Oula. And I think, if you have specific medical, like complex medical history, whether you take medication, you have a complex surgical history or other medical diagnoses that you know of that you want to kind of check in with us about our collaborative care model and see if that would be a good fit. The intake process is how you would do that. We are thrilled. I just want to highlight, we're absolutely thrilled to take care of patients who've had a previous cesarean birth and are interested in either a repeat scheduled cesarean birth or specifically trying for a vaginal birth after cesarean or a VBAC, as you'll hear it referred to. You'll see on our website, we have very, very successful VBAC rates. So I think it's a space where collaborative care really thrives because you really have the best of both worlds. You have your surgical expert and high-risk expert in our Oula OB who will meet with you and talk to you about kind of the implications of having a uterine scar going through this new pregnancy journey. And then you have your midwife there guiding you through this new pregnancy that is a normal experience. And what could that be like? What could that look like? And what would that feel like for you? And so I think it's a space where we really thrive. So we're thrilled to take care of patients who are in that category. Okay. I think we can chat about the intake a little bit. Oh, of course, all our great videos. Kelsey, I'll pass the baton to you.
Absolutely. Thank you, Casey. Yeah, so before chatting about the intake process, I just wanted to highlight we have an incredible YouTube channel where there are a ton of incredible educational videos, a lot of FAQs that you may find the answer to. I direct all of you to check out our YouTube channel. So there's the link there. If you check out the YouTube videos, and then for the intake process, if you check out the videos, if after hearing about, Oula through our open house and you're saying, that you would like to establish care with Oula. I just want to chat a little bit about what that the first initial steps look like. So the first step is to book a virtual intake appointment on our website. So you can go to oulahealth.com. It'll walk you through creating a profile, asking you some questions about your pregnancy, and then you book the virtual intake appointment. So I understand that there's going to be questions ahead of the virtual intake appointment. And I want to welcome all of you to email us at hello@oulahealth.com. Those questions come to myself and my team. We'll be happy to answer any general questions you have about Oula, if it's the right care for you, if it's a right fit. Because that virtual intake appointment is an establishing care appointment. So we definitely want to provide space to reach out to us if you have any questions before booking that virtual intake. So again, welcome any general questions to email us at hello@oulahealth.com. So after booking the virtual intake, if you get all your general questions answered and you do decide that it's a good fit for you. So again, you book that virtual intake, complete the intake form. This helps us to get a little bit more information about the health history, some general questions for our clinical team to review. And then we accept new patients up until the 24th week of pregnancy. And if you are receiving prenatal care before coming to us, we'll request your medical records as a part of that intake process as well. All right, and that leads us to the Q&A section of the open house. So I appreciate your attention here, and I'm going to run through a couple of the questions that are coming in. So the first one that we'll have Casey answer is, if you can speak a little bit more about what are the different options for managing pain in labor at MSW.
Yeah, definitely. I mentioned it briefly in the presentation, but just to clarify, we kind of work with you when we help to build your birth plan together, to think about how you want to manage pain, knowing that might change once you're in labor, right? But it helps us to set you up for success on the path of what is your preference and your vision for your birth experience. And so we're able to support you for unmedicated labor at Mount Sinai West. Like I said, there is access to hydrotherapy in an in-suite shower in all of our patient rooms on the labor floor. And we have policies in place that support using that, such as intermittent fetal monitoring, which is a very kind of midwifery-led, midwifery-supported policy that is evidence-based. And we also have nitrous available to our patients, and you're eligible to be on intermittent monitoring with that as well. And we're one of the few hospital systems in New York City that does offer nitrous, even though nitrous is used all around the world and has a very safe profile. And so we're thrilled to be able to use that, and a lot of our patients have been really happy to have that as a possibility in managing pain. And then, of course, epidural is kind of the most standard tool. And like I said, we have that available 24/7, and we work with you to kind of talk about what does that look like. In our group classes, we talk about this. We talk about the different choices that you'll make in our individual prenatal sessions, as well as having information about these decisions in the portal. And so we're there to kind of support that decision-making process. And then, like I said, if things change when you're in labor, we're there to help navigate that with you in real time.
Thank you, Casey. The next one is if you can talk a little bit about how Oula works with doulas.
Yes. So, I think there is a misconception in the world about kind of when I was mentioning kind of what is a midwife, right? Is a midwife a doula, right? we love doulas, and many of us were doulas before we became midwives. But midwives are your independent, licensed clinical medical provider, right? And we are your advocate within the hospital system. That is a different role than being a doula. That said, doulas are an integral part of the experience that we want to deliver to our patients here at Oula. And so we work with an equitable framework to make sure that all of our patients who want to work with a doula are able to. We have found that Mount Sinai West is extremely doula friendly. When we, and a doula who comes with you to the hospital is integrated as part of your care team on the labor floor. So we don't provide direct doula service as part of who we are at Oula today, but we do make sure that you have the referral and that is part of your care team and part of what your personalized collaborative care can look like, if that's something that is part of your birth plan and vision.
Thank you, Casey. And then if you can talk a little bit more about the role of the OB. I know you mentioned briefly, but the role of the OB at Oula, and how is this different than a traditional hospital clinic setting OB?
Yeah, so I think it is a little bit different in that we are more midwifery driven today at Oula, meaning that, as I mentioned, it's sort of like everybody enters care with our midwives. And if things come up, that is when you would interact with and be cared for by an OB, right? But the assumption is that overall, pregnancy is a normal physiologic life event, right? And so with that lens, when there are things that come up, as they do, and that is part of our training as clinical midwives, to identify those situations, we have this collaborative relationship with our OBGYNs. And so our Oula OBGYN team is growing. And so they're on the labor floor more and more. And so I think you'll see that in the new year. We'll be growing our OB team on the labor floor. And we are seamlessly integrated into our hospital partnership at Mount Sinai West. So it's really one team when you arrive on labor and delivery, but your Oula midwife will be there to help navigate, introduce you if there's a new clinician that you're meeting, but you will always have a collaborative care team that is midwifery driven as part of your care at Oula today.
Thank you, Casey. And I know we're just a couple minutes left. I think we have room for one more. If you can please talk a little bit about what the postpartum stay at MSW looks like.
Yeah, that's a great question. So, we have an opportunity for early discharge, which is 24 hours after vaginal delivery, which is, some people love that and are very interested in that and want to get home. But insurance does cover 2 nights after a normal vaginal birth in the hospital. I would say that, private rooms are, I know, the thing that most people are looking for when they're doing like shopping around for hospital systems. I will say it is not 100% guaranteed that you will have a private room at Mount Sinai West. However, overwhelming majority of our patients do. And so, we will work with you to make sure that that's as good an experience as possible. And I think for the most part, it works. And like I said, kind of when you're thinking about your hospital system, you want to really think about holistically the whole experience. And, the postpartum stay is one part of that, but it's not everything, right? And so that's kind of what we took into consideration when we chose this partnership. I think the things that really are a highlight in the postpartum space at Mount Sinai West are that we do have in-house lactation support for all patients that come through the hospital system. And we have really amazing nurses who are experts in lactation as well as kind of holistic postpartum care. We've created lots of proactive education. All of our patients go home with a postpartum booklet on the labor floor, on the postpartum floor after you've given birth with us, that has tons of pearls of wisdom collected across the midwifery team at Oula to share with you. So that's a little bit of flavor that I can share.
Absolutely. Thank you so much, Casey. And I understand if there's any questions that we didn't get to, I would love to connect with you all individually. If you email us at hello@oulahealth.com, we're happy to answer any questions that we didn't have time to answer today. Again, that's hello@oulahealth.com. Reach out and we will be so happy to connect with you to answer any individual questions. Thank you all so much for coming. I hope you learned a little bit more about Oula. Very excited to connect with you all. And I hope you have a great rest of your evening. Thank you, Casey.
Yeah, be well, everyone. Thanks for joining and good luck on your pregnancy journey. Be well. Take care.